So getting to the topic at hand, the truth about low back pain. Our mission today is to discuss the traditional management of low back and spine related pain, and then provide you guys with education on the management of low back and spine pain. And then towards the end, we're going to look at some exercise options for preventing low back and spine related pain. And Jared's actually going to demonstrate a few of those for you guys today. So before we go any further, I want to put a poll question up here on the screen. And what I want to do is I want to see if you guys can answer this question for us. What is the #1 predictor of spine surgery in the United States? I'm going to give you guys a few moments to answer that. Your answer is anonymous, so there is no judging by Jared or I. Maybe Jared, but not me.
Thanks, Mike.
Yeah,
Appreciate it.
Yeah. All right, so we've got some questions, some answers coming through here. Don't be shy. Like I said, we can't tell who's answering what. All right, a few more seconds here if anyone wants to get their last answer in. And you guys will should be able to see the poll results here in just a second. So a lot of people said MRI of herniated disc, pain severity and location, and loss of strength. We had one person who got the right answer. The biggest predictor of whether you are going to have spine surgery in the United States is based on where you live. If you have a large population of spine surgeons in your area, you are much more likely to have spine surgery. And we're going to talk about why that is a little bit as we move forward. So I'm going to turn it over to Jared now, and he's going to talk about some of that topic now.
Yeah, so if we look at some of the numbers here, we see at first, right, that the rate of back surgery in the United States is 40% higher than in any other country in the world. And like Mike just touched on, the big part of it is actually the access to your surgeon, the type of healthcare you have, right? Those all go into the steps you need to get a diagnosis, and they all contribute to the increased surgical output, right? And not just in lumbar spine surgeries, spinal fusions, things like that, but other orthopedic surgeries there as well. So if we look at spinal fusions specifically, right, just for this lecture here, surgery rates have increased 6 times over the past 25 years. The cost per surgery has tripled, and greater than $15 billion have been spent on fusions each year. So if you look at our chart here, right, you see in the late 1990s, that's when they started increasing the marketing of spinal fusion products. And just from there, it's skyrocketed, right? The amount of surgeries that are being performed and the dollar amount that it costs. So you think about the stress that this is putting on our healthcare system and the amount of surgeries that are taking place, it's unheard of. And the thing is, and the thing we got to remember here is that despite this increase in growth in the spinal fusions, right, the amount of surgeries, the money that it costs, we're worse than ever at treating low back pain. So going on to our outcomes, right, they've shown to have some poor outcomes of spinal fusions. I mean, just looking at this study here from 2013, right, workers' compensation study, where they took 725 fusions versus 725 controls, which are people who did not get anything. One out of 4 had a repeated surgery, right? 1 out of 10 had a second fusion after only 2 years of getting that fusion done. 1 out of 3 experienced major complications, and we're talking about decreased strength that does not return. You're talking about bowel and bladder dysfunctions. We're talking neurological symptoms down into the lower extremities. And 1 out of 3 did not return to work at all. So they go into having the surgery thinking that this is going to cure all their problems here, and they end up leaving work forever or changing jobs because of the spinal fusions. So taking a little bit more of a direct approach here, right, just kind of narrowing down into a case study here. I don't know if a lot of you know who this is, but this is Steve Kerr. He is the head basketball coach of the Golden State Warriors. He has gone on in the public, in the media, saying how these back surgeries that he's had has totally affected the way that he's able to coach, the way that he's able to get out with his players, the ability to do the things that he needs to do and he loves. So if we look at it, right, look at his quote, you know, I can tell you that if you're listening out there, if you have a back problem, stay away from surgery. I can say that from the bottom of my heart, rehab, 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 right? Don't let anyone get in there. He even had to take time off during his season because of these back pains that he had after the surgery and the complications after the surgery. So here, we think that this is an atypical type of story, right? Oh, this doesn't happen, but it's really not. We hear about this more and more coming out with these spinal fusions down the road there. So going on here, we're going to toss it back over to Mike just for talk a little bit about the dollars.
Okay, so I got another quiz for you here. So another opportunity for you guys to see what you're made of. So what I'm going to launch here is I want you to look at these here. Healthcare dollars spent on treating low back pain every year is equal to the healthcare dollars spent on treating which of the following? So I'll give you guys a moment to submit your answers and then we will review that.
This is a good one here, Mike. This is a good quiz.
Yeah, thank you. I appreciate it.
Concussions, shoulder, knee, cancer, Lyme disease. Tough.
Yeah. All right, so a few more seconds here, and then I'm going to end the polling for you guys. All right, and so for those of you who have joined us since the last one, I promise you it's all anonymous. I can't tell who you are, so I'm not gonna call you out. So the answer is cancer. So we spend as much money on treating low back pain every year as we do cancer, which is one of the most draining diagnoses for the healthcare system. So when we look at the financial burden of low back pain on the healthcare system, 86 billion healthcare dollars are spent on low back pain every year, which accounts for about 25% of all healthcare expenses. Again, that is 25% of all medical healthcare expenses, equal to cancer. The healthcare expenses for somebody who ends up with low back pain on an individual level will be about 60% higher than the person who does not experience low back pain. So it just highlights the true financial impact on us as individuals and the healthcare system from a financial standpoint. And this slide, I'm going to spend some time talking about part of the reason why that is. So some of you out there may have gone through this experience. A typical episode of low back pain in the US typically occurs after you have the initial injury or pain. You're probably going to call your primary care doctor. You're going to go in for a visit. At that visit, they may prescribe you some muscle relaxers or some painkillers. You may or may not fill those. You may or may not take those. You come back to your primary care physician after your pain and your symptoms don't resolve and you don't get back to your normal activity. So now you're coming in for your second office visit, which means a second copay and a second bill to your insurance company, and then plus those 2 scripts you already filled. At this point, your doctor's probably going to refer you for imaging, or they're going to refer you to a specialist. And if they refer you to the specialist is going to probably not see you until they get the X-ray and the MRI. So by the time you get through paying for the X-ray and the MRI, now you get in to see the specialist. You're on your 3rd copay. Your insurance company is billed for the 3rd office visit. You've had 2 scripts that you filled. You've had the X-ray copay. You had the MRI copay. And then, oh yeah, the insurance also got billed for those as well. At this point, the physician may read the scan and determine that they want to do an injection. Once they give you that injection, they may or may not prescribe physical therapy. And we'll touch on that a little bit later, but they may or may not prescribe physical therapy where exercises are then given in order to guide you back to work. And Well, again, we're going to touch on that a little bit more later, but I can't emphasize this enough, and I know it's redundant, but by the time you start to even get to the treatment part, you've already paid 3 co-pays. Your insurance has been billed for 3 office visits. You've been billed and charged personally for the copay for the x-ray, the MRI, the injections, and any other scripts and medications you've had, and you really haven't even gotten to the treatment part of it yet. So, why are we so bad at managing low back pain? And what I want to also make clear here is that physical therapists are guilty of providing poor care as well. And the reason for that is, across the board, physicians, chiropractors, physical therapists, you name it, greater than 40% of people who are treated for low back pain are going to receive a treatment that has not known to be effective, meaning it hasn't been well researched and vetted and been proven to be an effective intervention for low back pain. So this creates a lot of variability in the healthcare system, where there may be hundreds of options from various different healthcare providers. And what ends up happening is, because you're not getting better, it increases cash flow and expenses, but it doesn't produce positive outcomes. And so when you look at practices generally as a whole, the adherence to clinical practice guidelines for spine care is less than 65%, meaning that less than 65% of clinicians and offices are actually using the most evidence-based interventions to treat your back pain. And a lot of this is driven by personal opinion and bias, which again creates a high degree of variability. And this isn't just physicians. This isn't just specialists. It includes, unfortunately, our profession as well, physical therapists. And to further emphasize some of these points, a study that looked at Medicare claims in July of 2017 showed that of 472,000 Medicare claims related to low back pain, 74% did not receive a studied treatment, meaning that 3 out of 4 people who were treated for low back pain did not receive a treatment that was proven effective in the research. And of those total 472,000, only 13% had received physical therapy or even been recommended to physical therapy. I'm going to turn it back to Jared now.
Yeah, so the question is, we looked at the typical episode on low back, right? And you saw the imaging that's going to come up, right? Some insurances require it before you see the specialist. So the question is, do we really need it? And research has never shown a link between findings on an MRI or X-ray and low back or neck pain. Lumbar disc degeneration is present in 90% of individuals ages 50 to 55. 48% of individuals ages 20 to 22 have at least one degenerative disc. A study in April of 2014 looked at 98 tennis players with no history of low back pain. 90% of them had abnormal lumbar spine findings on imaging without any source of back pain. So looking at the last thing here, MRI studies of healthy adults found that 90% of subjects with no neck pain had evidence of degenerative changes. If we look at in 2015, if we go on to the next slide there, 2015 study of 1,211 cervical spine MRIs of asymptomatic subjects, 87.6% of people without neck or arm pain had at least one cervical spine disc bulge, which means that the imaging that we're getting, even though it can be useful for major problems, the source of the pain that you have, if you do have low back pain, is probably not coming from these disc bulges. Because a guy like myself, or Mike, or anyone without back pain currently, if you get an image, these studies are showing that you probably have some abnormal findings. And that's okay. That's normal aging. That's how the spine should go. It's stable spine. It's able to heal itself, where it's able to heal with proper movements and exercise. But because the disc bulge doesn't necessarily mean this is your pain and we need to remove it from you. So research has shown that unnecessary imaging can be psychologically and emotionally harmful. Right? A patient's knowledge of imaging abnormalities can decrease self-perception of health and may lead to fear avoidance and catastrophizing behaviors. Right? So we look at the terms on the right, degeneration, bone on bone, old age, disc disease, arthritis. These are all things that it's like healthcare is a business, and the fear that it puts in people. And again, PTs are not immune to this. We've heard PTs do the same exact thing here. They're giving fear. They're putting it in you about your knees are bone on bone. You can't run anymore. You can't do this. And really, we've seen that that's not the case. The imaging does not support those types of findings there. So, in the United States, just getting an MRI increases your likelihood of surgery by 34%. Again, going back, let's think about the data here. 34% likelihood of getting surgery, even though that's probably not what's causing your pain. So that means when you get out of your surgery, you may still have that same exact pain that you had before, but now you've had damage to your spine that cannot be reversed. Providers and patients must be aware when early MRI is not indicated, it provides no benefits and no worse outcomes are likely. So,
worse outcomes are likely.
I'm sorry, what did I say?
You said no worse outcomes.
Worse outcomes are likely. Excuse me. So for individuals with low back pain who received imaging as a first management, total healthcare costs were higher by an average of $4,793. We don't use imaging for ankle sprains or headaches. So why are we doing this just specifically for low back pain? This doesn't make sense.
So let's talk about, managing your low back pain and what's the solution. What the research out there shows is that early physical therapy is associated with better outcomes and overall lower healthcare costs. And we already kind of showed you why some of those costs can be skyrocketing. It also reduces your likelihood of needing surgery or ending up needing advanced imaging like the MRIs or being placed on opioids for pain management. Clinical practice guidelines for the management of low back pain support the use of manual therapy and exercise for treating low back pain. The problem is that only 2% of patients with low back pain are ever referred ever start with physical therapy. Usually by the time people get to what research shows is the most effective form of treatment, we've already spent all those copays, all those bills to your insurance company before you get to the most proven and effective means for treating it. Only 2% actually start with physical therapy. And the research, again, backs up that exercise and education resulted in a 45% reduction in lower back pain episodes. So if you're getting the right exercise and the right education, you have a significant likelihood that you're going to reduce the incidence and the frequency of low back pain. Also, when it relates to missing time from work, which is again another cost element here, exercise results in a 75% reduction in lower back pain and related sick leave. And part of the importance here is that we need to start doing a better job of educating on the misinformation regarding your spine and lifting, etc. If you're having low back pain, you shouldn't be taking medication and laying on the couch. What you need to be doing is learning the right ways to move in order to get your spine moving again. Your spine is built and designed to move. We need to keep it moving so that it remains healthy. If you lay down and let it get stiff and stop moving it, you are more prone to exacerbate those symptoms. So what I'm going to do is put one more poll up here for you guys. So I'm going to give you a few seconds to answer this one. With this, I'm going to ask you to select any of these activities that you think are safe, that are generally safe to do if you've had a history of low back pain. So you can select all that apply. Jared, do you have any thoughts on that?
On this one?
What do you think?
Let me take a look here. Let me see what we've got. Is generally safe with history of low back pain. Oh my gosh. Multiple choices? I would say.
And there's a lot of choices up there. I
Could be
probably
all of
could
them.
have given less choices.
Could be all, Mike. I'm not sure. You know, if you believe the theories, if you got low back pain, you shouldn't run.
All right, so I'm going to end the polling here so you guys can see the answers. So pretty much everybody agrees that pelvic tilts and abdominal squeezes are generally safe to do. Few people, only about 27% answered deadlifting. So the answer is that all of these exercises are generally safe to do with a history of low back pain. There is no activity on here that is or should be necessarily prevent you. I'm sorry. There is no exercise on here that you should be prevented from being able to do if you have a history of low back pain. None of these exercises are inherently dangerous for you. There is quality research that shows that deadlifting, when done in conjunction with other exercises for low back pain, is a great exercise for reducing low back pain because it really helps strengthen the muscles of the low back. When we look at another activity like running is actually shown, there are studies that show that running actually improves the density of the discs between your vertebrae and can actually be a beneficial exercise to do. Picking up your child is an activity. Less than half of people think that answered that they felt that was safe to do with a history of low back pain. And that's something that if you're a parent, if you're a grandparent, you're an uncle, you're an aunt, is something that we would all love to do. It is not something that you should be prevented from doing because you have low back pain. It is not inherently dangerous to do. Jared, anything you want to add to that?
No, I mean, I think that what you're talking about there, we just need to get over that conception that because I've got back pain, I can't do X, Y, and Z, for an extended period of time. We should be able to do all those things.
Yeah,
absolutely.
And I mean, nobody's saying that if you have pain right now that you should just go right out tomorrow and start doing all these things. Obviously, there is a way to build you up to be able to do these things, but having the back pain itself does not prevent you from doing them. And in some cases, those exercises are shown to be very beneficial. So this is a lot of, the education that, again, we hear, not just, physicians or chiropractors, educating their patients on, but even, unfortunately, physical therapists, saying things like you have the back of a 75-year-old. Jared already talked about the findings that we are getting in x-rays and MRIs that show that a lot of these changes are normal changes that occur with age. Need to take it easy and avoid bending or lifting. You have degenerative changes that will only get worse with age. Stop if you feel pain or let your pain guide your activities. Your spine is out of alignment. These are all things that promote fear and avoiding and movement avoidance. And like we talked about, exercise and movement is the most effective treatment for back pain. So these can actually be a detriment to a person. So these are the things that you should be looking for, whether that's with a clinician like Jared or myself, or if you have a therapist that you're happy with and you like. I'm not trying to convince you to come to Jared or I, but they should be, promoting your self-efficacy and your confidence. Someone who's going to, educate you that your back pain doesn't mean that your back is damaged. The spine is one of the strongest structures in your body. If we think about it logically, the spine's main job is to protect our spinal cord, which is vital for not just our survival, but our ability for procreation. It stands to reason that we would protect something so vital to us as our spinal cord with something that's strong and not protect that with something that's inherently fragile. So it's important to understand that your spine is generally very strong and one of the strongest structures in your body. Your back gets stronger with movement, and that's where those exercises can really be beneficial to you. But avoiding movement can weaken muscles, lead to atrophy, which again can lead to more stiffness, which then can lead to an increase in your pain, which creates a vicious cycle, because as you get more pain, you avoid moving. As you avoid moving, you have more pain. And pain is rarely associated with tissue damage versus needing to just move better and maybe strengthen some muscles.
So looking at the power of exercise. Okay, so we've talked about the surgery side. Mike has already noted that exercise with manual therapy has already been proven to benefit, right, or to improve low back pain. So let's look at some of the powers of exercise. First of all, it reduces the risk by 30% of dementia, heart disease, and then some cancers. Reduces the risk by 45% of getting colon cancer, and reduces the risk by 50% of type 2 diabetes, having a stroke, right, and high blood pressure. Exercise is a drug. It's medicine. But, you know, the big pharma companies out there, they don't want you to know that it's the best drug. It's the best drug out there, and it's easy because any sort of activity you do around the house, it can be the smallest thing, is exercise. So for physical therapy, what we like to do in the clinic, right, you'll see us go through an assessment of what's going on. We'll use mobilizations to help improve spinal mobility, thoracic, lumbar mobility of your hips. We'll do manual therapies other than mobilizations, right, to stretch, mobilize, and then we'll add in exercises, which is one of the key parts to improve on those deficits found during the evaluation. So right now, what we're going to do is we're going to go over some of these basic exercises that you'll see, whether that be in the clinic or just kind of online. The first one being an open book. So let me just get kind of set up here. I just want to demonstrate this for you. All right. So I know I might not be big on your screen, but that's why we had the picture there as well. So the first thing we're going to do, okay, is called an open book. So you're going to be lying on your side. All right, you can have your hand under your head or out in front of you. You're going to take your top leg, put it over top, and then this is key, it needs to stay on the floor. Otherwise, when you go to rotate and your knee pops off, you're actually not doing the exercise anymore. So you're going to start hands together, knee down. You're going to open up and try to rotate as far as you can. Again, keeping this knee down. You can always hold that knee in place or just have it out to the side. The key here is you're looking for thoracic and lumbar rotation. Now, if this is too intense, you can always put your knees together and do the same thing. Or if you're starting to experience shoulder pain, which we have in some of the clinics here, we've noted people having shoulder pain as well. You can just put your hand across your chest and then focus on dropping your shoulder down towards the ground. So the next one here is thoracic extensions on a foam roller. Now, if you don't have a foam roller at home, okay, what you can do is roll up a pillow or have a yoga mat, which I have here rolled up. You're going to put this behind your spine, right below your shoulder blades. You're going to keep your knees bent, put your hands behind your head, and then you're just looking to extend straight down there. The reason why we're working on the thoracic spine and not directly on the lumbar spine is that your thoracic spine wants to be mobile and your lumbar spine wants to be stable, right? Those are kind of how they go. And when your thoracic spine is restricted, your lumbar spine has to do some extra movements to get you where you want to go. Whether that be reaching up overhead, you have to extend your lumbar spine. So improving thoracic mobility will affect your lumbar stability. So again, hands behind the head, extending down, or if you're having shoulder pain, right, you can put your arms across your chest, one arm behind, and then extending over top there. Okay, again, a great way to affect the thoracic spine, which in turn will help with the lumbar spine. So the next one I'm going to do here is kneeling hip flexor stretch. You're going to have to just raise this up just a little bit. There we go. You're going to be knee down on the ground, other knee out in front of you, chest up nice and tall, so my head's going to be cut off, but that's okay. You don't need to see my head anyway. You're going to be pushing your hips forward, stretching out the front side of your hip here. Again, you don't want to lean so far forward that you're arching your back. You don't want to cause any too much tightness or restriction back here. You should be feeling this all in the front of the hips. And if you have any questions or suggestions you want to throw in there as I'm talking, feel free.
No, you look like you know what you're talking about.
Yeah, well, I hope so. All right. Now, so belly nice and tight, pushing the hips forward, feeling that stretch. Again, the reason why we're attacking the front here of the hip is if we're having too much tightness in the front, that can cause an anterior pelvic tilt. And again, causing too much tightness, restriction and stiffness in the low back. And then when you go to lift that box or you go to bend down without the proper mobility, you can start to have, that can contribute to your back pain. The last one we'll go over here is the prone press up to a cat camel. So a prone press up just means lying on your stomach, putting your hands right next to your chest, pushing straight down and trying your best to leave your hips on the floor. We're getting maximum lumbar extension here. Okay, and then going into your cat, going into your camel here, your cat camel, prone press up, and then you're going to sit all the way back into that lumbar flexion. So now you're getting a little bit of both of lumbar extension here into transitioning into lumbar flexion going through here. Some problems that you can have or some adjustments you may need is if you're having, they may be too intense for a lumbar at first. So you may want to adjust by not going into so much of the prone extension or just going on your elbows to start. This could be all you go to, and then you transition from there into your cat and cow or your sit backs. Okay. The other thing too is if you're having too much shoulder pain from this, you may want to adjust and be able to go onto the wall, having your hands on the wall, letting your hips sink into the wall, and then out again. Again, many different ways to be able to get that lumbar extension and then lumbar flexion to improve that range of motion and to allow that back pain to be decreased there.
All right.
Yeah, like that.
All right, so let me pull up this here. So we are almost, we are getting to the end here. All right, so we talked about the open books, the foam roll extension. If you guys have any questions on any of these, please feel free to email either Jared or I directly, and we can answer those questions, or you can send it to the general Kinetic, it's Kinetic, Jared, it's Kinetic Physical Therapy, Kinetic PTPA @gmail.com.
Yeah.
And one of us will respond to you there as well.
Hey, Mike, real quick, before you do that, restart your video. It seems like it's got a close-up on you. Just want to get us back to the way that we kind of were there. Without the spotlight.
Yeah, is that any better?
Sorry.
There?
Yep, we're good. Yeah, mine was all closed. Zoomed
Okay.
up real tight, so we're good.
Nobody wants to see that. All right.
Now, I wouldn't want it on me, so that's why I thought I'd throw it out to you.
No, I appreciate that. All right, so I've got one last polling question, I promise. True or false, a physician prescription is required to begin physical therapy? All right, I'll give you guys just a couple more seconds here. All right, so most people got this correct. The correct answer is false. You do not need a physician's script to see a physical therapist in the state of Pennsylvania. Pennsylvania is a direct access state. Most private healthcare insurances do provide coverage if you access a physical therapist first. You do not need to go to your physician. And one thing that you want to look for, though, is make sure that you are looking for a provider implementing evidence-based care for musculoskeletal conditions. So like we were talking about before, you want to find a clinician who truly is up on the research and is giving you the most up-to-date evidence-based care. The other thing with direct access is it certainly can reduce costs, and as we've shown you with the research, it's shown to be the most effective, form of treatment for low back pain. And I'm going to touch on this very briefly. Over the course of the current coronavirus pandemic, there's been a lot of legislation that has been fast-tracked on telehealth. So if you're having issues at the moment and feel like you're concerned about leaving the home because of the virus, telehealth services are available in a lot of clinics. Kinetic is certainly one of those clinics, but a lot of facilities are doing that as well. And that goes for primary care physicians, and as well as, you know, if you're having mental health issues, all of these are covered under the telehealth legislation that was passed. So in conclusion, physical therapy can reduce your total episode costs as well as improve the outcomes for low back pain. Physical therapy is the cheapest treatment option and most effective in the long run. And the biggest take-home point is I want to caution people on the fact that advanced imaging is not, or is likely not necessary for mechanical low back and neck pain. 90 to 95% of people do not need that imaging that they are receiving, and we've shown how much it can increase your cost of care. So stay active, stay educated, and work with someone you trust to give you that quality education and that you're looking for. So next week, we're gonna go over and cover some more strength training that you can do for the low back pain. I promise it won't be as long as this session. The goal is to get it done in about 10 or 15 minutes. If you're not able to attend that session, we will be recording it and posting that on our social media, primarily our YouTube channel. So if you can't make it to the live session next week, please let us know. In the meantime, if you have any questions that maybe you thought of after we leave the session that you'd like answered, please email us. Our goal is to hold weekly sessions that are open to anybody. We encourage you to join us as you feel you need. And Jared will kind of talk about how to keep an eye out for those.
Yeah, so using our social media pages, right? We're on Facebook, Instagram, right? Twitter. Check all those things for updates on new webinar courses that are coming out for us, question and answers, or something more formal like this. We're going to go to a slide at the very end here, right? That will put all of our handles down. So make sure that you check those, right? Make sure you follow us there. That way you'll get the most up-to-date information through social media. And if you also have any other questions, our emails are at the bottom there, and you can find that on our website as well at www.kineticptpa.com.
Great.